So, good afternoon, everyone. It is my great pleasure to warmly welcome you to today's webinar. That is the fourth and last webinar of our webinar series, Gain Insight into Nordic Market. Today, we will focus on the Finnish healthcare. My name is Minna Komu. I come from northern Finland, from the city of Oulu, and I work as a network director for Oulu Health ecosystem. I have here also my colleague, Joanna Seppänen, who will help me today. Joanna, please, you may introduce yourself.
Good afternoon, everyone. It's a great pleasure to be part of the webinar. I work in the same team together with Minna as a marketing and communications coordinator, and I will help with today's webinar.
Thank you, Joanna. And before we will get started, I would appreciate if you will keep your mics muted during the presentation. However, at the same time, I hope to keep this very interactive. So please raise your hand and ask your questions whenever you will have them. Today's webinar will consist of 4 different modules. First, I will provide you the introduction to Finnish healthcare system. Then I will tell you more about the test beds in Finland. Then we will go to hospital and care section and procurement. Last but not least, we will focus on the big health and social reform that is ongoing at the moment in Finland. If there will be any problems, if you cannot see my slides or cannot hear me, please let me know. Very shortly, some facts about Finland. So we are about 5.5 million people. We are a multi-party country that has been independent for more than 100 years. So we are part of the European Union and the only Nordic country, as you know, that is part of the euro currency zone. In Finland, the capital region is definitely the most highly populated area in Finland. And then the other university cities, university hospital cities, Tampere, Oulu and Turku are the next biggest cities. Jyväskylä is the 4th one, but actually the fifth university hospital is located in Kuopio. Finland is generally considered as a small giant in health. And what we mean by that, we mean that Finland has been rated.
How the brain works in the context.
Sorry? So Finland has been rated to #1 in value for money healthcare. So generally, the quality and equality of healthcare services here in Finland is high, and if we are in this slide, you can see that when we measure the outcomes, Finland, Norway, and Switzerland share the #1 ranking. But there is a difference when we compare how much money we will use for providing the health services. So Finland, I'm not sure now you can see my pointer. So Finland is here. So we have here the health outcomes, and here we have the how much money is provided, and it's matched to the purchasing power. And Finland can deliver the healthcare services more cost efficiently than Norway and Switzerland, that were together with us sharing the #1 position in what comes to outcomes. Generally, the Finnish healthcare system is based on public healthcare services, which everyone residing in the country is entitled. It is according to our constitution in Finland that the public authorities shall guarantee for everyone the adequate social, health, and medical services. In addition, we do have also private healthcare services operating here. So we have universal healthcare for everyone. Even in our on political level, from the strategy point of view, the focus is on prevention and health promotion. And then the third topic here is that we have so-called three-level publicly funded healthcare system. And then this private sector that is relatively small. What we mean by three-level healthcare services, so that's illustrated here. So the structure of municipal healthcare, so we have primary healthcare that is offered in healthcare centers, and currently they are quite numerous in Finland. The secondary healthcare is provided by hospital districts, and the tertiary healthcare, so the specialized healthcare, is provided by university hospitals, that there are 5 in Finland, and they are also owned by the municipalities. So the social and health services in Finland, at the moment still, municipalities are responsible for funding and organizing the social and healthcare services. And these are covered by tax revenue. And then there is tiny client fee that covers roughly 7% of the expenditure. Municipalities may also purchase the services from the private sector, so that is possible. And the current situation is that municipal social and health expenditure is roughly 57% of the total municipal budget. Then there are Finland is generally all about digital and electronic format, also what comes to the medical records. So Finland has already for years had 100% electronic medical records, and these are all accessible via Kanta service. So Kanta gathers together the social care data, the patient data, the prescription data, and personal health records. And these are stored in national data bank. And healthcare professionals can access the needed data nationwide and store the patient records and make prescription. What this means is that if I am prescribed medicine in Oulu and then I will go to Helsinki and I run out of my medicine, I can go with my health insurance or with my ID card to pharmacy, and then they can see my prescription there. We have lots and lots of national registries containing data for every Finnish citizens. And this data is, of course, a very valuable source for providing and developing also the healthcare services. What I wanted to tell you here also is the FinData. So FinData is our national one-stop shop. So this is for authorities or institutions or companies, and you can access the Finnish, the health and social data via FinData. And FinData is the one that grants grants the permits for the secondary use of the health and social data. So what is then? Of course, the primary use is the one that is used when we are for the medical professionals who are taking care of us, and then the secondary use is, for example, for research and so on. And for 2.5 years, we have had an act on the secondary use of health and social data. It came valid in 2019, and this is now the way how, or it enables the data to be used also for research and development purposes, and this ensures that authorities, institutions, and companies have access to health and social data. And of course, all these are GDPR compatible. Then something more about how we are as a country what comes to the health sector. So we have health sector growth strategy, and more the importance of the data is the focus is more and more on data and how we utilize the data also to develop better healthcare services for the citizens in the future. And so for this growth strategy, we have the political commitment of Finland to be an international hub for versatile and high quality scientific research, inventions, and innovations. Also, the public-private collaboration is the one that is truly on the focus, as well as the dynamic operating environment for the new companies. Finland also, or this growth strategy also points out that we are aiming to be, and we are a reliable partner for the international growth companies, as well as an attractive target county for health sector investments. And truly the focus is on sustainable and personalized healthcare. Finnish people in general are very loyal, and why we emphasize it here, it's that in Finland, when we have the culture of trust, first of all, people are generally willing to participate in the medical research, and then also the dropout rate is very low. So if they start, they usually take it to the end, while the situation can be different in some other countries. And in Finland, the digital health records are truly seen as an opportunity to develop better treatment for the future. That was the short introduction, how the system in general is here in Finland. Was there something that I left out and did not tell you and you wanted to know? If so, please raise your hand or write your question to the chat box and we can go through those. If not, we will continue to the test beds in Finland. The test beds are located in every university hospital cities. And of course, these are not considered as, and they are not selling channels to university hospitals. However, the role of the test beds is super important for the companies, for the new technologies, for the healthcare professionals to be exposed to new innovations, as well as for the companies to truly receive a feedback from the end users. And therefore, I wanted to include here a few slides about the test beds that we have in Finland. We have a good amount of health and well-being test beds in Finland, and they are also in national collaboration, as well as then part of the Nordic proof, also for the Nordic collaboration. And what these test beds are, or what is this purpose? It is that they are the platform enabling the health tech and other companies to develop their solutions and services in authentic or simulated environments, together with the healthcare professionals, and to receive the feedback from the healthcare professionals. There are different type of test beds, as you will soon hear more, and they range anything from home environment to specialized healthcare. When the testbed could be a possibility, generally testbeds can be used in any phase of the R&D project, or even when your product is already market proved and market ready, but you want to receive the feedback in Finnish healthcare sector. And the testbeds in Finland, they serve companies of all sizes in every phase of the innovation. So you can get, if you have an idea, or so you can, there are evaluation boards available to give you feedbacks for your idea, or you can come with your minimum viable product or prototype and test that and receive the feedback. And what is the importance, or what is the right phase? The right phase cannot be, or there is not a simple answer. However, the earlier on in your R&D project you will utilize the test beds, the better the outcome is, because then based on the feedback, you can still make some modifications when they are still, or when from regulatory point of view, it is still possible to make the changes. We have 5 university hospitals in Finland, and everyone has the test beds, and then there are a few other ones. I will soon tell you more. And why Finland? Why Finland would be a good place for you to test? It is because, first of all, we have a wide versatility of the test beds. We have the 5G test networks in place. You can have the access to health data, and you can find the environment that is a match and fit for purpose for your needs. And users can be anything. They can be Finnish companies or international companies. So they are not only open for Finnish ones. So as I mentioned that there are 5 university hospitals. Now they are put on a map. So we come, Joanna and myself, come from Oulu, from the city of Oulu, and in city of Oulu we have Oulu Health Labs, and it consists of 3 different environments. We have environment for specialized healthcare. It is located within university hospital, but in a patient restricted area, allowing and giving us the freedom to truly test the innovations. We have Oulu Welfare Lab, that is the platform for home care and for primary care. So any location where the primary healthcare is provided, like elderly homes or home care in people's home or in healthcare centers, can be used as a testing platform. And then in University of Applied Sciences, excuse me, in University of Applied Sciences, we have a combination of 7 different simulation environments that are also a valuable environment, especially for usability tests. When we go a bit down, there is Kuopio Living Lab. Kuopio is extremely strong in neurosciences, for example, and they have their living labs in university hospital and healthcare centers and homes, and is available there together with these healthcare professionals. This one here is Health Hub Tampere, and they also have R&D simulation testing and training platform for co-creation purposes or testing your product. In southwest Finland, we have a Health Campus Turku, and they have there especially the pediatric test beds as well as pet center. In the capital area, we have a HUS, Helsinki University Hospital test bed, and it is located within the university hospital, and there is the operating room that is also open for these testing purposes. And as mentioned, these test beds, they work in national collaboration. They know very much what are also the core strengths of each and every test beds. And for example, if in Oulu we will receive an inquiry for some test case, and we know that there would be a even better match for this purpose. For example, if it's something neuroscience, we might encourage them to contact Kuopio, but they can be conducted, of course, also in Oulu. So here we have the 5 that I just mentioned. We also have some other labs. For well-being services, there is an active life lab in one University of Applied Sciences. There is also the future hospital environment and ELSA test bed there. And out of these test beds, Oulu and Helsinki are also part of the Nordic Proof. And within the Nordic Proof networks, there are also test beds in Sweden and Norway. And I'm not actually sure if there is at the current moment from Denmark, but we truly hope there will be. So now I saw that we received some questions. Did we, Jonna?
Yes, we have some questions. For example, Minna, do we get charged for the test beds? How much does it cost to test?
Yes. So we do have some price tags for the test beds. Why there is a price tag? It is because the test beds are, for example, in Oulu, the test beds are run by public authorities, and according to law, public authorities cannot directly support the R&D of the private companies. So, for example, in Oulu Health Labs, there is a price tag. The price tags are very reasonable, and of course, there are many different kind of services available. We can include into the chat box, Jonna, if you can include, for example, link to Oulu Health Labs web pages. So then you can even find the prices on the website. And I saw that we have at least Kaisu Sutinen here. So Kaisu, if you have quickly the direct link to whose Helsinki test bed services, you may include some link to the chat box. So yes, there is a price tag for a reason, but the prices are definitely reasonable level.
Sorry, Minna, I have to say, I have a funny Teams bug. I don't have access to the chat at all. So we will have to take this offline.
Okay.
Sorry.
Okay, so I don't know why it is so, but we will share with you the information later on. We can, or you can use the links to the living labs if you want to find the specific prices for each and every test beds. However, I of course always encourage you to contact the test beds, because perhaps your case is not necessarily something you can easily pinpoint from the service list.
We have one more question.
Yeah.
Is there an official application form for test beds? So how can we get in touch with test beds?
Yes. So now I have to say that I actually don't know the situation for each and every test beds that are listed here. But for example, again, example from Oulu, the link Joanna included, there is a contact form. And although I said that Oulu Health Labs consist of 3 different testing environments, you don't need to know which one is the right for your test case, but there is only a one contact form where you describe your case, and then frequently the team leaders of the test beds will go through those and then come back to you with a proposal. Thank you. So we will go forward and now focus on the hospital and care section, and then the procurement in Finland. So as mentioned, that we have the primary care in Finland, and the primary care consists of anything. As you can see, there are huge number of puzzle pieces that all together forms the primary care. It is anything from rehabilitation to home care, to healthcare centers, to mental care, and so on. And then the specialized healthcare is provided in the 5 university hospitals that are here again pointed onto the map. And in addition, we have then we have also then the hospital districts that are here. Why I don't want to go into too much detail with this one is that this one holds true only until the end of this year. Soon I will tell you a bit more about the health and social services reform that will be valid from the January 1st next year. So therefore, this time is a bit confusing, or not confusing, but we're in the middle of a big change. The private healthcare. So the private sector is private healthcare sector is something that might be easier to access with your company's innovation or service or product. And I listed here the 3 biggest companies in Finland that they are in the private healthcare sector. They are Terveystalo, Mehiläinen, and Pihlajalinna. All of them do have various locations throughout the Finland. More and more, as we mentioned, that the digital healthcare is more in the focus, And anyway, even if it's a medical device, very often when we look to the future, they are somehow connected, and perhaps there is some data integration with the patient health record systems. And I listed here the ones that are mostly used. They are classified here and like for hospital use, and then for the healthcare centers. Apotti, the EPIC system, is currently in use in Helsinki area, and it is for both for hospital and healthcare part. ESCO system is ESCO electronic patient health record system. So it is somehow exceptional because it has not been developed by a company, but it has been developed by Oulu University Hospital. And it has been rated to be the best electronic patient health record system in many years in a row in Finland. At the moment, ESCO is only available for specialized healthcare, but currently they are building the primary healthcare part there because of this health and social reform that we will soon discuss a bit more. Life care by Tietoevry is used a lot in both ones, as well as Mediatri and Pegasus. Then there are some specific, for example, for radiology and so on. Private sector, they do have their own electronic patient health record systems. Then I listed here a few examples of the hospital construction projects that are currently ongoing in Finland, or at least soon to begin in Finland. And there are, of course, many more, but I wanted to list here some, as the new hospitals are, of course, always also a big possibility. The first three are examples from the southern Finland. So Helsinki area, the Laakso Hospital is for a psychiatric hospital for Helsinki, and there will be demanding neurological rehabilitation, as well as then outpatient clinics that support the hospital's operations. And then there is a huge Siltasairaala Bridge Hospital project in Helsinki, and it will be there in the Meilahti hospital area, and it will be the largest construction project in the history of Helsinki University Hospital. In Jorvi, Espoo, there is also projects ongoing, and online you will find more information about all of these. And in Kuopio, they are also there. They have their own hospital building project called Uusi Sydän, New Heart. I'm not sure if they are anyhow using that term in English. My apologies, but wanted to translate you what the Uusi Sydän means. And so Kuopio main hospital will be renovated, and then they will build a new 10-story hospital section. And this is now ongoing at least to the year 25. In Oulu, we have huge project, 1.6 billion euro project. So we are currently rebuilding the whole Oulu University Hospital and building the future hospital. So, and it is built into the same lot. So there is always old part will be teared down, and then the new building will be built on that lot. And in the first phase, it was the garage, and then the hospital, the sea level people, or let's say that the base offices were teared down, who are responsible for leading the hospital functions, and we find new places for them. And now the phase 1, that consists of 2 buildings, will be taken into use next year. And the second phase, there is already a permission for construction. And for each of these, by Googling, you will find more information also in English. But then how it is to sell to university hospitals. So generally in Finland, everything is a public procurement. We have a specific system that is called Hilma. It is also in English. As you can see, this is a snapshot from the web page, so you can choose the language here. Often, although I have to admit that often the answer or the offer should be then given in one of our official languages, but then usually there is Finnish and Swedish as an option. But Hilma is the one that by following Hilma, you will get the information about the new procurement offers that there will be. So we have a National Procurement Act, and the focus is on responsibility aspects and being able to have economically and qualitatively and systemically the best one as possible. And also more and more the sustainable points are pointed out. There is also innovative procurement part, and that is for new or significantly improved products or services. And sometimes these can be if something is, for example, co-created in the testbed environments. And there is currently the political statement that the amount of innovative procurement should be increased to 10%. I wanted to highlight you also the health technology assessment, as well as then the Digi health technology assessment. So Digi HTA is a criteria tool for assessing digital healthcare services like mobile apps, AI solutions, and robotics, and the suitability for the use in the healthcare. And if you're familiar with the health technology assessment, the DGHTA is to somewhat the same purpose, but only aimed for digital health solutions. And it covers the key elements of the healthcare services, such as effectiveness, costs, usability, and safety. And based on the criteria, then the experts conducting the assessment can give recommendations on how suitable the different products are for the use in healthcare. And then the recommendations support further the health policy and clinical decision making. The product developers and manufacturers, so you as a company representatives, can also use the criteria for self-assessment and utilize the information in your product development. In Oulu University Hospital, we have the Finnish Coordination Center for Health and Technology Assessment, and so the DGHTA is developed within or in Oulu in collaboration also with the Ministry of Health and Social Affairs. So that was about how the hospitals are at the moment and how the procurement is. Do you have any questions?
There is a very nice question in a chat box, and I believe we will have some examples to share also from Oulu to answer it. The question is, could you, Minna, share some examples of successfully commercialized innovations that result from the cooperation with testbeds?
Oh yes, we have many. I think it would take a whole another presentation, but as Jon and myself, we come from Oulu, we will give the examples from Oulu. Oulu is specialized to the demand-driven co-creation and co-innovation. And what we mean by that is that we, for example, collect the ideas from the healthcare professionals, and they tell what they lack in their everyday work. And then we have communicated those as a challenges for companies. We are not stating that it should be this shaped of an answer, but we will just communicate it as a challenge, and a company can then come up with their solution or their suggestion, and then the services are co-developed in the testbed environment. And one great example is NE device that so in Oulu University Hospital's emergency room, there was a nurse who mentioned that it would be so valuable to be able to measure vital signs like the heart rate and the breathing rhythm remotely without hooking them or without having anything connected to the patient. And so that they know that they will act on time if needed. But yeah, and then as you know, that typically the new health tech innovations that are under the regulatory approval takes 5 to 10 years. And it was a bit more than 2 years that with the from idea to CE marked regulatory approved product, the VitaCam and Oulu University Hospital staff were able to co-create in Oulu Health Labs or utilizing Oulu Health Labs as a platform. And I want to highlight that the company did not have any prior experience in healthcare sector. They were and is a software company. There are many, many more innovations, and not all of the, so NE Device is Oulu-based company, but for example, Buddy Healthcare that is from the southern Finland, they have been our partner in solving this kind of co-creation challenges. So they are not only entitled to Oulu-based companies.
Thank you, Minna. One more question.
Okay.
You mentioned that some part of healthcare is privatized. It's private in Finland. What part of healthcare would that typically be?
What part of the healthcare? So not the percentage wise, but what are actually, if considered percentage wise, how much the private care is, I actually don't know. The private care can be used, or let's say that there are, now I obviously didn't have a clear answer. Let's retake. So for example, surgeries and pediatric care and so on is a lot conducted also by private sector. So for example, I have children and I have insurance for my children so that I can take them to the private healthcare if something unexpected occurs, because then I know that I will get my time on point and not need to queue in hospital or in healthcare sectors. Also I actually, Kaisu, now I'm asking for your help. Do you know the part in Finland, part of healthcare?
I can think of one thing, and that would be occupational health care,
Yes.
which I think is obvious to you as soon as you hear it, because Terveystalo and Mehiläinen own most of that market. So very many employers have agreements to send their people to care through that way. Unfortunately, I don't have the percentage data either, but that would be something I would add to Minna's answer.
Thank you, guys. So that was a good addition. Then
Anytime, darling.
Then also in some areas, in some geographical areas, public sector can also purchase additional support from the private healthcare side if they don't have own personnel enough to match the requirements how fast people should be taken care of. I hope to some extent we answered your question.
Do we have time for one more question?
Yes.
The question is, how do you work with foreign companies interested in scaling to Finland? Do you have a strategy, support plan, for example, with a paid service from Oulu Health to help them?
I actually have, let's come to that in the end of my presentation, as I included some slides for this to answer this kind of questions. And Business Finland provides the services for free, but let's go through that in a few minutes. Now, something about the health and social services reform. I wanted to include the information about this because the January 1st, 23 is there very soon. So the health and social services reform is the biggest act in Finland for, I'm not sure if in a whole history, but at least for a long time. If you think that in the beginning of next year, 173,000 people will have a new employer. So that is a huge amount of people that this affects directly. So health and social services reform will restructure the organization of the public healthcare and the social welfare in Finland. Also, rescue services is part of this one. So the blue one here illustrates the current model. There is 195 health and social care organizations and 22 rescue services. And in the beginning of next year, there will be 21 well-being areas, and then that are responsible for health and social care and rescue services. The exception here is Helsinki. So city of Helsinki is this +1, as it is not a well-being area, but will continue as a city of Helsinki. So there will be 21 self-governing well-being areas or well-being service counties established, and then city of Helsinki. In January, so few weeks ago, we had the elections and the county council members were selected already, and they start this work in the 1st of March, so in 2 weeks roughly. And now these well-being counties are then responsible for organizing health and social and rescue services. So pretty much like everything. What is left with municipalities is the responsibility to promoting the health and well-being for the residents. Why we have this reform, what the objectives are. So the reform is definitely one of the most significant administrative reforms in Finnish history. And the goal is to reform, or the goal of the reform is to safeguard equal and quality health and social services for all and reduce the inequalities in health and well-being, so that the health and social services will use best and most efficient practices. And also with this reform, we ensure the availability of skilled labor, improve the safety, and respond to the challenges arising from the changes in the society. There is a web page. Oh, I'm sorry, I will include the link here. It is soteuudistus.fi, and they also have an English sub-page that is more restrictive, but in Swedish, of course, there is all the same information as in Finnish. So I only want to highlight that the changes are huge, that are effective in the beginning of next year, and thereafter you're not anymore selling to specific hospital, but you're selling to well-being county. However, based on all the information we have at the moment, the same system applies for procurement. So the Hilma system is still in use also for the well-being counties. But most likely there will be bigger, the purchases will be bigger, as of course it is for the benefit of the whole well-being area. For the whole well-being area that you can see here, for example, our well-being area is this one here. So of course it is the benefit if the systems and services and products are the same used in all the, for example, the healthcare centers in this well-being county. But my apologies that we don't have any solid set of information to share, as they are all working on it currently. But now to answer the question that if Finland would be the place for scaling up your business. So why you would like to scale your business in Finland? Finland is known to be the #1 in innovation talent. That is, the environment here is truly pro innovations. There are already many major global players that have chosen Finland, like Bayer, for example, that has a big facilities in the southeast Finland in Turku region. And why big health companies choose Finland is that we have one of the lowest corporate tax rates in Europe, only 20%. And then we are the only Nordic country with the euro. That might also be beneficial for other Nordic countries. And then highly skilled brain power at the very reasonable or very competitive cost. More reasons why to expand to Finland, but this one now pretty much answers to that question, is that Business Finland services for international companies, they are many. They, for example, cover data collection and analysis, opportunity analysis, guidance on entry alternatives, networking, location management, and setting up a business. And all these comprehensive set of services are confidential and complementary. So these are free of charge, and you may, of course, contact if you don't know immediately who to contact. So you can go to Business Finland webpage or you can always, of course, contact us, whose email address you know or phone number you know, and we will help and connect you. We work all the health ecosystems in Finland works in very collaborative manner, as well as then we all work together with the Business Finland to be able to create even better surrounding for future healthcare innovations and future healthcare market for innovative companies in Finland. So with these words, I would like to thank you for your attention. Should you have any more questions, it will be my pleasure to answer them. Thank you.
We don't have any more questions in the chat box, but still a few minutes, so please open your microphone, and now it's the time to ask the question.
Yes, and I want to highlight that the prior 3 presentations, Sweden, Norway, Denmark, and now the Finland one, all these you will find the recordings as well as then the slide set from the Norcare or from the web page that you used for signing in for the webinar. Please, Dr. Dirk.
Hello from Lübeck in Germany. Thank you very much for your presentation. Sorry, I don't have a camera here, but I have a question regarding the medical device regulation by the European, by European Union.
Yeah.
Presently, there are 2 notified bodies in Finland for the MDR. Do you know if there are going to be more, or is that it?
We know that there are. We hope there will be more. We know already a few examples that this application is now pending, and we hope that the European authorities will soon have time to go through these applications and hopefully will give and show the green light. We truly hope there will be more.
Okay, and the same with the IVDR, the in vitro diagnostics?
Yes, the same holds true also for the IVDR. Yeah.
Thank you.
You're welcome. Did I see someone else raising a hand? Joni.
Yes, hello. This is Joni from Business Finland in Norway. Regarding the invest in activities, a good name is Tobias Petrini, who works for Invest in Finland at Business Finland, and he's the one point of contact for M&A activities or larger investments towards Finland, and he's responsible for all of the Scandinavian countries. So Tobias Petrini is a good name to remember. Thank you.
Thank you, Joni. Could you be so kind that you could type the name into the chat box? So then it's easier for people to get the name right.
Yes, thank you.
Thank you, Joni. That was an excellent addition. So now we have utilized our 1 hour. I truly thank you all for your attention and hope that you found the presentation valuable. Should you have any questions in the future, please do not hesitate to contact us. You can see my contact information there, but if you, for example, go to Oulu Health web page, you can find Joanna's, mine, and the other colleagues of ours. Thank you and enjoy your day.